It is time to check in with infectious disease specialist Dr. Zain Chagla. Good morning. Happy Friday. Thanks for joining us.
Hi, good morning, Bob.
Good morning. Oh, I've really enjoyed our COVID-19 chats for the last couple of years, but let's transition for a moment to monkeypox. So, first up, what the hell? Yeah. I mean, really, like we're at the tail end of the pandemic and this happens. This is actually, it's been percolating in Africa for years though, hasn't it?
Yeah, there's been, a large rise in cases from 2016 onwards, mainly in the Democratic Republic of Congo. There's been a big outbreak in Nigeria. And I think we realized, look, our world is globalized. I can get on a plane and be in Kinshasa or in Lagos or elsewhere in the world in 24 hours. What happens in another area of the world affects us.
So what mistakes were made
ignoring, infectious. Yeah, I mean, I think that's it. There was an emergence of this disease. There were cases that were rising in the DRC. And I think we kind of just sat and said it was over there. We've seen a few little cases in the UK and the US kind of pop over, but nothing of serious concern. And we thought, it could be contained and it would never come to the West. And the reality is, again, we're all interlinked. What happens in the animal system, what happens in the human system, what happens everywhere can end up in Canada very quickly. And we have to be very cognizant of that fact.
So there was some naivete there. Are there, on the positive side, what are the key differences between monkeypox and COVID-19 in terms of managing it and staying on top of it?
Yeah, it's spreading slower than COVID-19, which is important. Many of the cases here, although we don't have links, seem to be in the gay and bi MSM community, and seem to be growing at a very small pace as compared to COVID-19. Much of the transmission seems to be kind of intimate, close contact. And so, again, the ability for it to kind of infect and have super spreader events is less common. And, again, we have a vaccine, right? And it's actually here. It's being deployed. There have been, doses given in Canada already to people that have been exposed. And now Montreal is even giving it to people that are considered high risk.
Yeah, so that's an important distinction.
We have a lot of these techniques. Yeah, absolutely. And there's been tabletop exercises in terms of how to deal with this, recognizing that this could be an infectious disease threat that comes over. So, again, we're not behind the eight ball here.
Right.
We have treatments, we have vaccinations. We have a lot more in place. There is a lot more work that needs to be done in terms of testing and reaching population.
Quickly alluding to something you mentioned earlier.
Yeah.
Sorry, I just want to allude to something you mentioned earlier. So Alberta's Chief Medical Officer of Health is being criticized for posting on social media. The majority of global cases have been among men who have reported intimate relations with other men. What is the correct messaging, the science-first messaging here?
Yeah, I mean, look, there's a lot we've learned from HIV, right? We want to make sure that populations are not stigmatized when, they become the risk population. It doesn't mean that we can't ignore that. Like, we do have to make sure that we partner with GBMSM communities. We have proactive messaging. We partner providers that are, responsible for dealing with sexual health in those communities and making sure that they're aware, that making sure patients are encouraged to test, et cetera. It still means we need testing for the general population and we can't lose sight that there may be other populations affected. But at the same time, we can be sensitive and non-stigmatizing, but still recognize that is the population at risk right now.
Yeah. Well, we got to go, but COVID-19 isn't going away, so we'll chat again about that as well. We appreciate your Friday visits on Morning Live. Infectious disease specialist Dr. Zain Chagla. Have a great weekend.